Hello, everyone. Welcome to our Zoom meeting. Today, we'll have three topics. Dr. Hajer and her team will be presenting. So all of you, you're welcome, and thank you for joining. Thank you, Dr. Hajer. When you are ready and your team, you can go ahead.
Thank you. Thank you very much. Hello, everyone. I hope you are having a good day. Today, I'm presenting, moderating the Gray Group meeting. Our agenda for today will be, the first one will be chronic care management presented by Dr. Sarra Gabralla and Dr. Tarig Ali. The second agenda will be how to use ePrognosis by Dr. Esra Mustafa. The third agenda will be video recording, Loom, using Loom, presented by Dr. Wessam Omer. And the last thing will be project updates. Thank you. And let us go, Dr. Sarra. Let me share the screen for you.
Dr. Hajer, now you are the host, so you can share, try again. Dr. Hajer, okay, thanks.
Let me check. Sorry for that. Are you able to see now?
Yes.
Okay, thank you.
Salam alaikum. Yes. Salam alaikum.
Alaikum salam.
Hey, sorry for that. Actually, my microphone, I can't unmute myself for a while. So, sorry for the interruption.
We're fine. Go ahead.
Yes. Salam alaikum. Hi, everyone. Hi, Dr. Nadia. My name is Sarra Gabralla. I will present today chronic care management, me and Dr. Tarig. So this topic is very, Yes. Are you hearing me well? Hello?
Yes, we can hear.
You hear me? Okay. Yeah.
Good.
So I will present chronic care management. And as I said, this topic is very large topic and it has a lot of doors. So we try to do like summarize and give you guys like a big idea of it. Because chronic disease, it could be chronic heart disease, it could be chronic kidney disease, it could be any chronic disease. So we can best touch on some ideas and we can find in Dr. Nadir has a lot of links for the big pictures. So we start with chronic care management premise. So first we have to do right thing in the right patient and at the right time. What we mean by right thing, so every patient with chronic disease, we should do the right investigation, the right imaging. So that will ease thing for the patient and not add extra stress for the patient by doing a lot of unnecessary investigation, unnecessary imaging. So we have to try to do the right thing for the right patient. Right patient means that every patient has own plan and has own disease. So every patient, we should identify and try to do the best care for this patient with the team and everything. And we should do the right thing for this right patient. Also, right times mean that we take our times, we try to do our best investigation for this patient, not a rush. And if we don't know yet the diagnosis or the right treatment for the patients, we can act as a team to do our best discussing all the information about the patients until at the right time we gathering the right diagnosis and give him the right treatment. So the next will be mobilize community resources. So patients participate in effective community programs, form partnership to fill gaps in needed service and avoid duplicating effort, and advocate for policies to improve patient care. So we use all the community resources toward benefit for that patient, to do our best as a team to provide the best services for this patient. Health system organization of care, improvement at all levels of the organization, promote effective strategies, open and systematic handling of errors and quality issues to improve care, and provide incentives based on quality of care, facilitate care coordination within and across organization. So this is like health system organization of care. The goal is improvement at all levels of the organization to bring up an effective strategies and to avoid errors and to facilitate the care coordination. Self-management support. Patient has a central role in managing health. Self-management and support strategies. So we have to share all the information, the diagnosis, and explain that to the patients. And of course, the patient has a very important role in the management plan. If he got the right information, the right diagnosis, and we have to check the understanding of the patient. So he will be the center of our care. We have support strategies like assessment, goal setting, action planning, problem solving, and follow-up. And finally, the community resources to support the self-management. We have to give the patient all the community resources so that it can help him in support self-management. This is the chronic care management model. Of course, we have like two arms of this model, the community one and the health system one. The community one is resources and policies, like build a healthy public policy, create supportive environment, and strengthen community actions. For the health system, we have like self-management, develop personal skills, delivery system design, reorient health service, decision support, and informational system. By doing this model, we have to productive interactions and relationship. So we have also inform activated patients. So patient must be informed with all the plan that teams come out for these patients, like the diagnosis. The patient must be well knowledge of his diagnosis, the treatment, the complications, like everything that help the patients to participate well in his management. And also for the team, we have every member of the team, like the doctors, the nurse practitioner, the pharmacist, the physician assistant, any like team member that participate in this patient management should be very well informed and well prepared to participate in the patient management. And by the team, we try to prevent the hierarchy. So every member of the team has the same importance, can participate, we can correct each other, we can act to the best of the patient to give the patient the best care, the best treatment, and the best plan. And this is the decision support, like daily practice of evidence-based care, share clinical guidelines and information with the patients, provide professional education, and integrate specialties and primary care. This will be my last slides, and then Dr. Tarig will continue with the same topics. This is about clinical information system. So this is actually very important, especially for the patient with chronic disease. We should have like timely reminders for providers and patients. So there is a lot of app, and here in my city, they use MyChart. It's like mobile app. Every patient log in and can see his informations, like the upcoming appointment, the lab result, and even he can message his provider and ask questions. And they are really good in connecting the patient with the provider. they got an answer within 24 hours. They can see all the lab results, the previous visit summarized, and the upcoming visit, and everything. So this is very effective in connect the patients and remind him for his upcoming appointment. And he can also schedule appointments if he need that. So also identify subpopulations for proactive care and facilitate individual patient care planning. Also share information and monitor outcomes. For monitor outcomes, you should not just treat the patients and just discharge him. Also, we have follow up that patient to see how things going on with him. And also we have, if the patient is hospitalized and we provide the best of care for him, we should schedule an upcoming appointment with his primary care provider. We should follow with that, and we should see the outcomes, how is things going with that patient. So our role is not just to treat the patient at the moment, and also our goal is to see out the outcome and to reduce the hospitalization for the patient with chronic disease, because this will add a lot of stressor to the patient if he readmission to the hospital for like multiple times. So we should tell the patient all the information, what the symptoms bring patient to the hospital, what the symptoms make the patients go to his primary care physicians, so we can reduce them readmission, as I said. And I think that is all, and I will let Dr. Tarig to present the rest of the topic. Thank you so much, Dr. Nadia. Thank you, Hajer, and thank you, everyone. Ramadan Kareem.
Welcome. Thank you, Sarra.
Assalamu alaikum to everybody. Ramadan Mubarak. This is Tarig. This is Dr. Tariq Ali. So just today, this is my first presentation. I'm going to start to continue with the Dr. Sarra left. So in the chronic management, care. So I'm going to start with the chronic care management programs. There is many chronic care management programs, as example, comprehensive system change and targeting approach and case management approach. The two things I'm going to focus on it today is like here in targeting approach and case management approach. So the targeting approach, as example, if I have an example of like the patient who have an example like of an asthma, chronic asthma with a several exacerbation attack. If we want to reduce the attack, so we have to educate the patient how to cope with exacerbation and to be avoiding any kind of exacerbating risk that can exacerbate his symptom or her symptom. So with that things, and we also have to set follow up for this kind of to target the like healthy person with to reduce the hospitalization for a lot of time. So, and for the case management approach, so there's three things in the case management approach we focus on it. It's like brief hospitalization, low intensity follow-up care, and conduct utilization review. This is going to be all about this is concise because the topic is big, but just I summarize these three things in the chronic care management program. So I'm going to go furthermore to delivery system design. So delivery system design is being defined rules and distribute the task between the patient and the doctor. So and also goes to the plan interaction for the evidence-based care. It depends in if the patient by each appointment or visiting the doctor, there is a set of things. Example like labs. If they have a labs, we have to do it. To have to order it. If they have a prescription of medicine, we have to prescribe. And if they have an alternative medicine, example, if they use any kind of medicine that has not worked with them before, or they have a side effect, so we have to change it to the alternative medicine. And also we have to set the follow-up too. So, and there's a clinical case management services for complex patient. We have to set it as, so some patients, they have a complex situation, and so we have to manage them. It's like different than the normal patient with the chronic, like one disease. Some people, they have 3 or 4 chronic disease, and they need a chronic management with the complex situation, and they've been suffering a lot. So we have to be like focusing on these two. So, and regular provider initiated follow-up, and also we have to initiate follow-up with the patient, and we have to schedule it, depends on their situation. Also, we have to look at the cultural sensitive care, depends on the patient background and how they come, where they come from, and cultural sensitive of the care for this is for different situations. So I'm gonna move to the primary health care delivery system. That is traditionally provide acute care, a diagnostic and laboratory for the patient. And the service is being done to the patient, treatment of the signs and symptoms. We have to focus on how to treatment the signs and symptoms. And we do the prescription and brief education about their disease diagnosis and how to educate themselves and how to get like the information. That is, we briefly focusing in the situation of the patient to educate them and intellectualize their opinion in the disease. And also we make the short appointments in several times. And also we said the patient initiated follow-up by each follow-up. When we finish our visit, so we have to set a follow-up for the next, because this is a chronic management sitting. We have to make it like a schedule by each month or by each 3 weeks or 4 weeks. It depends on how the situation of the patient. So this is going to be about the primary health care delivery system. Okay, this chart is showing the primary health physician use of electronic medical record. This record is like a while ago, but this is the only one that is I find it. So maybe there is a new one, but I'm not sure. So it's showing how the primary health physician use of electronic medical record. If we look at by country, so the Sweden is the top of the countries that they use the electronic, and the France has been the least country using the electronic medical record, and United States is being 17%. So, okay, and how to improve the healthcare status? We're gonna move to how to improve it. With regular visits with the health provider, we have to set regular. As the main goal in the chronic care management is you have to be like regular visit with the health provider and focus on the function of the procedure itself and function of the patient, how is dealing with coping with the stress, dealing with the disease itself, and how they deal with it. And also we have to prevent any exacerbation and complication. This is our main goal to improve the health status. We have to prevent any kind of exacerbation and complication. And also we have to emphasize self-management towards the patient. We have to emphasize how the patient self-manage themselves about taking their medicine in the exact time and managing, example, if somebody having obesity or something like that, they have to consistently be in exercise, to lose weight and being strict with their diet program. So this is to emphasize the self-management and ensure access to the service proven to improve the outcome. And we have to check back if the patient, they gain access to the service, they come to the appointment, they take their prescription medicine usually and at the same time, at the exact time. So to be sure they do not missing any appointment or something like that. To fill it, this we have to be ensure about this one. And establish the link through the time with information system. And we have to also link the time, manner, and to see if they like being working well, doing well and everything. That is, we have to do it too. So, and we have to set follow-up initiated by the medical provider. This is the main goal of the chronic care management. So in a summary, it's going to be a last or final slide. So maybe there's one slide after it, but that one I listed before and I said before. So in summary, the chronic care management offer improved health status for many patients with a chronic disease. And chronic illness care should be based on the best available evidence So we have to focus on how to to treat the patient and management them properly, and we have to in a time manner to be concise, and we do everything in the right time. So I need consistent quality measure and additional research in the various models. So this is my last slide, and I hope guys you enjoy it, and thank you.
Thank you so much, Dr. Sarra and Dr. Tarig. This is very informative and concise topic. So anyone have question or? Yeah, we have Lima.
Oh, yeah. Thank you so much for the opportunity, and I would like to thank the presenters for the nice presentation. I just have one question. I couldn't get it by the data of primary care physicians' use of EMS with 17%. That's not clear. Does that mean that the physicians in primary care use 70% of physicians in primary care use EMR, or can you make it clear? Because as far as I know, everybody after every patient visit should use any type of EMR to try to document everything. Could be the physician or the scribe, but it will be documented anyway. So that's confusing for me. So can you make it a little bit more clear for me? Thank you.
Yeah, you're right about it, but as I said, this is a long time away. So just I searched it, I find this is the only one chart I found it about this information. So I listed, I said it's this is about 2002, it's a while ago being listed, but maybe it's changing now. So maybe there is new data about this information. So it's a little bit while ago. So, but just to show how the countries they've been using the electronic medical records. So.
Okay.
Yes.
Thank you.
Thank you.
Any question?
Thank you, both of you. This is a great presentation, and we can move on if no more questions.
Yeah. Our next agenda will be ePrognosis presented by Dr. Esra Mustafa. Esra, are you here? Let me stop sharing. Dr. Esra, are you here? If she is not here, we can go to the next one and then come back to Esra. The next will be Loom video recording by Dr. Wessam Omer.
Okay, assalamu alaikum everyone.
Alaikum assalam wa rahmatullah.
Ahlan wa sahlan. Yeah, hi, my name is Wessam Omer, and today I'm gonna presenting on the video recorder Loom. Let me first share my screen, please. Can you please enable screen sharing?
Yeah, I stopped sharing.
Okay.
Okay.
Try again, Dr. Wessam.
Okay. I will. Okay. Just want to make sure, guys. Do you see the Loom screen now?
Yes.
Okay.
Yeah.
Okay. Inshallah, خلاص. Bismillah. طيب. So as I said, my name is Wessam Omer, and I'm going to present the video recorder Loom. Loom is a video recording software that prides itself on its ease of use and versatility. It's simply a video messaging tool that allows us to convey our message through instant shareable video. And it made also editing simple. So in order to get Loom, you just need to Google Loom video recorder, and it will get you to this home page. Okay, so I'm gonna go over the website with you quickly. So here, let me see, 1 second, please. So the website homepage has a summary of the features, uses and uses of Loom, as well as the free and get Loom for free. And this is what we're gonna click in a few seconds. Before that, I just wanna talk about the pricing. So Loom can provide us with a free account for individual. This one can give us up to 25 video per person, up to 5 minutes a video. And also we can upgrade to the business account with this amount of money annually. It have other features, for example, the AI and editing the transcript. Okay, so when you click Get Loom for free, they're gonna require you to sign up either with your Google account or your email. And okay, so I already had an account, so I'm just gonna open my account here. Okay. After the sign up, they will ask you if you would like to download the desktop app or get the Google Chrome extension. So this is the Chrome extension up here. The Chrome extension is simpler and is what we will be using for this presentation today. So I click the extension. Now I'm inside my account. After that, they will guide you to set up your work space. They will require you to name your workspace and also invite team members. And you have your own homepage and your library. These are the videos I created so far. If you have any notification, it will be here. And you can now start recording the video immediately. So by clicking record the video here or new video there. So you just click here. Okay, now this page appeared to us on the right upper corner. They allow you to choose either you want to record the full screen, the window, the current tab, or camera only. Also, will ask you to have your camera on and set up the microphone if you have more than one. Oops, sorry, before you start recording. On the left lower corner here, this circle is called selfie bubble. It's basically your desktop camera. So hi everyone. So this selfie bubble, you can move it anywhere and place it anywhere in your during your presentation. You can maximize it or minimize it or close it altogether. And this also taskbar, during your recording, you can pause your video, restart it, or trim it. I'm going to show you in a few seconds how. So let's, okay, yeah, one more thing I just want to mention here. So there is some features that effect here. You can change your background and also, 1 second, please. There is also blur. So blur feature allows you to blur specific parts of your screen for privacy. And so now let's start recording a video, a very short video, maybe 1 minute video, just to show you how we're gonna edit that video afterward. I'm gonna pretend that I'm comparing two books for step 2, or I'm gonna like pretend I'm comparing first aid and master the board. So I'm gonna hit start recording. Here it asks me to choose the screen I'm gonna record. Now it start counting down. Okay, so let's pretend that I'm gonna compare master the board and first aid. So master the board is a very concise book, up to the point, make retention easy. It's a must for step 2 CK. And first aid is well known for everyone. We carry it throughout our preparation from step 1 till step 3. Both are really good resources. Okay, let me see now. Let's say if at any point I want to pause my recording, I can click pause and catch my breath, recollect my thought, or let a noise pass by and then resume. Also, if I'm not satisfied with my beginning or the introduction, I can restart my video again, or click rewind and trim, and maybe cut part of the video I already recorded. Just like that, and then trim and resume. Now you can still resume your recording, and then if you're done and everything is okay, now you can click stop. The minute you click stop, the video is here already. They put a title for it, but you can change the title and write whatever you want to write. Let's say name it book. And you also can edit the transcript. Here. So you can hit correct and delete a word, or like delete any unwanted like word in your script. And also you can trim and stitch your video before you share it. Let's say I don't like this part or that part, so we can easily trim it and then save and exit. And if you're satisfied with your video after you watch it, let me open that. So it's already there and I watch it and I'm okay with it. Now you can share the video by clicking share, either typing the email of the person you want to share it with, or simply copy the link and share it any way you want. Also, you can share it in a social media, or you can embed your video in a website. I guess that's everything. Now your video gonna be added to your library for future reference. So that's pretty it. It shows us how simple Loom is and how fast you can share and convey your message to people. Okay, and that's it. If you have any question, please let me know.
Yeah, thank you, Dr. Wessam. Interesting.
Oh, you're welcome.
Yeah.
Thank you.
Yeah, any questions? Yeah. Okay. Now let us go to the next agenda.
Thank you so much, Dr. Wessam. This is great. And yeah, go ahead, Dr. Hajer.
Thank you so much. Thank you, Dr. Nader. Hajer.
Yeah, next agenda is ePrognosis with Dr. Esra Mustafa.
I don't see her on the list here. Maybe she joined and she left, or do you have her contact?
Yeah, I contact her just before the meeting, and she.
So try to call her again and see if
Okay.
in the meantime, I'd like to just expand on the first presentation and second one. So the first presentation was great, and I think we can apply that in our practice, wherever you are here in the US or overseas. Some of the things that we were trying to do, and it might be of help, is
She is here, Dr. Nader. When you are done, she can come.
so basically we were trying to build some apps that mobile applications that can be used at home with the help of some of you guys for patients with chronic conditions like let's say hypertension also. So we can talk about that later, but thank you so much. So Dr. Esra, when you are ready. Thanks.
Okay, assalamu alaikum. Can you hear me?
Alaikum
Yes,
salam.
we can hear you, Dr. Esra. Go ahead.
Okay. Today, I'll be talking to you about prognosis. And by prognosis, wait, let me share my screen. Okay. It says only the host can share screen.
Try it again, please. Thank you.
Okay, can you see my screen?
Not yet.
Not yet.
Okay. I think you can see my screen now, right?
No, not yet.
Okay. Okay, I'll try rejoining again and then try to screen.